All right, class, this is chapter 11, and we're going to learn today about nutrients involved in bone health. Okay, first I have some questions for you. So I'm going to say them, and then at the very end, we're going to revisit them. So true or false, bone is a living and consistently changing tissue. So look for the answer to these while we give the presentation. True or false, bone is the source of red and white blood cells. Trivia, how many bones does our body contain? And true or false, milk is the only good source of calcium. And think of what you think the answers are to these right now, and then, compare them to what you learn at the end of the session. All right, this is a picture of bone, and I'm not going to talk about the actual structure of bone a lot, but if you want, you can read more about it in your book. One thing that's very interesting about bone is it actually is vascular. So you see there are blood vessels inside of the bone, and that's where we usually call the bone marrow. And the bone marrow is actually involved in making many of our cells. Bone growth and remodeling. So everyone knows that our bones grow, starting at infancy until when we reach our maximum height, whatever that is. However, our bones are constantly changing, they're constantly breaking down, and we are rebuilding them. The breakdown hopefully isn't a lot that we even notice it, but it's small changes, breaking down and rebuilding bones. And this is a really good function of bones because this is what allows us to heal if we break a bone. If our bones weren't capable of rebuilding, if we broke a bone, that would be it. And so there's two types of cells that are important to this bone remodeling. Osteoblasts, I think of B, so blasts build bone, and osteoclasts kill bone, even though it's C and K. Let's just say they kill bone or they break down bone. Why would we want to even break down our bone? Well, the answer to that is that we store many minerals inside our bones. And in fact, most of these minerals are stored more in bone than any other place in the body. So if we're low on these minerals, say we haven't been eating enough, we can break down the bone just a little bit to release them. Okay, so bone length and remodeling. I did talk about this a little bit. When do our bones stop growing? The answer to that is a little bit two-sided. Our bones get as thick and as strong as they're ever going to get, usually before age 30. And this is called our peak bone mass. However, after age 30, it is still very possible for the bones to break down and rebuild. They just don't usually get stronger than they were right around this age. And so because we have this thing called peak bone mass, it's really important that we make our bones as strong as we can when we can, which is those first 30 years of life, because after that, we're just going to be breaking down and rebuilding and breaking down and rebuilding. And eventually, the process of breaking down occurs more frequently and to a greater extent than the process of rebuilding. And then things like fractures occur. So these are some of the things that influence peak bone mass, and we're actually going to talk about these coming up. Okay, so there are biological factors and lifestyle factors, and some of them do slightly overlap, but I'll go over them anyways. So the first one is gender. Women generally have lower bone density than men, and they generally have lower peak bone mass than men. Age, like I said, after age 30, we've pretty much achieved our peak bone mass. And as we become elderly, we're actually losing bone mass. Ethnicity, Caucasians and Asians and Asian Americans tend to have lower bone density than African Americans or Africans. Frame size, larger people tend to have greater peak bone mass. And this could be big boned people or even slightly overweight people. Estrogen. So estrogen is a hormone. It's released by the female reproductive system, as well as it's released in both females and males by some of the fat cells. And estrogen stimulates osteoblast cells. And remember, blasts build. And so if a woman doesn't have enough estrogen or has kind of irregular patterns in this hormone, she might not be building her bones to her greatest extent. So if she has irregular periods, after she's gone through menopause, etc., this can significantly impact her ability to make new bone. Additional factors. So these are things that can be changed, even though, like I said, there is some overlap. So having a good diet is obviously important, and we're going to talk about all the details of diet coming up. Healthy body weight. This means, having just the right amount of muscle, the right amount of fat, etc., for overall health. People who are very, very underweight do have low bone density, and people who are very, very overweight don't necessarily have low bone density, but they have a lot of stress on those bones, as well as the muscles and the joints supporting those bones. So that can be equally dangerous. Weight-bearing exercise is very good and actually stimulates bone growth. So here you see a gymnast. She is an elderly gymnast, so good for her. But gymnastics is actually one of the best activities to stimulate bone growth. Not smoking, because smoking can cause some oxidative damage as well as interfering with estrogen synthesis. There are certain medications that can impact bone health and interfere with calcium absorption, for example, antibiotics. And so it's important to ask your doctor about any medications you're on. And then very high intakes of phosphorus, protein, sodium, caffeine, and alcohol. All of these could be associated with lower calcium intakes or increased calcium excretion. And then inadequate UVB exposure, because we're going to learn that we can actually make vitamin D from the sun. And why am I talking about vitamin D right now? I thought we were talking about calcium, but vitamin D is one of the key factors that can help us absorb calcium. Oh, the one thing that I had here that was overlapping is this normal menses. Menses is the menstrual cycle, and we did see it on the last slide. This could be considered something a woman could change. If she noticed her menstrual cycle was irregular, she could go to the doctor, seek help, see if she had some hormone imbalances, or if it was irregular due to extreme physical activity or an eating disorder. Potentially a woman could seek help for that as well. So more environmental factors, some of the ones we just talked about, but a little bit more detail. Smoking, I did say, interferes with estrogen synthesis. Smoking also can cause oxidative damage. Alcohol, I mentioned, and then acid generated by diet. I did say we would talk about diet more. Certain foods, when we eat them, cause our body to produce acid. And that acid eventually can change the acidity of our bloodstream or our blood. Changing the acidity of our blood is very, very dangerous. Our blood likes to maintain a stable acidity. It's usually between 7.35 and 7.45 pH. So to not allow this to get out of control, what our body will do is it will actually break down our bone a little bit, because bone has many of those minerals in it, and those minerals are basic and they can counteract the effects of foods that are acid-producing foods. Also, if we eat foods that are alkaline-producing or foods that will produce bases, such as fruits and vegetables, that can help balance acidic foods in our diet. And these are not acidic foods, these are acidic producing foods. So they cause acidic breakdown products. Calcium. So these are some fill in the blanks. I think I'm not going to tell you the answers to these, and I want you to take notes throughout the presentation and be able to answer them on your own. You're going to find out. Well, I hope you'll find out. Maybe I'll tell you. Okay, so calcium is found in our bones. Everyone's heard drink milk. It does a body good. It helps your bones. There's lots of other ways that we can help our bones besides drinking milk. But calcium is stored in our bones. Only 1% is in our blood. I already mentioned which vitamin was important, so I'm not going to say that again. And then the body is really good at maintaining calcium levels in the blood. However, it does this at expense of the bones. So the body can actually break down the bones if the blood calcium levels are too low. Additional functions of calcium. It's important for many, many more factors besides our bones. Some of them are listed here. Calcium is important for muscle contraction. It allows our muscles to relax after a muscle contraction. Calcium is important for nerve transmission. It helps with neurotransmitter release and permits flow of ions in and out of the nerve cells. It's important for cellular metabolism, blood pressure, and blood glucose regulation. And I did say that it is found in the bones, but it is also found in the teeth. The teeth are a little bit different than the bones, but they are one of our additional sources or stores of calcium. So how do we get enough calcium, and what is enough calcium? How much do we need? So here you have a chart looking at age and then calcium intakes, as well as the RDA. So when people are very, very young, obviously their RDA, which is shown here in this kind of, I don't know, tan color, is a little bit lower. But as they're growing, the RDA peaks up to 1,300. And this is because people in this age group, you can see it's increasing starting at infancy, and then it goes right around till age 18. But these people are really, really building their bone at this age. This is where they're developing some of that peak bone mass. Then the RDA drops off for many, many years to about 1,000. And then in old age, since bone breakdown is more rapid, and there's many things affecting calcium levels, such as changes in vitamin D synthesis, the RDA goes back up again. Here in green, you can see the average of what males actually consume and the average of what females actually consume. So only in early childhood and infancy are people actually consuming enough. So yeah, we need more calcium, and we need it from healthy food sources. These are some food sources. You do see a lot of dairy here. You also see red, that's the fortified orange juice. You see cereal. Calcium is added to a lot of breakfast cereals. Also, a lot of breakfast bars and protein type bars have calcium in it. You also see purple, and purple is protein food. So we've got some fatty fish as well as some tofu. This is just another way to look at sources of calcium. And in the US, about 75% of our calcium intakes come from dairy. We're going to talk about dairy alternatives, but most dairy alternatives, such as soy or hemp milk, also are fortified with calcium. I shouldn't say also, because dairy products are naturally high in calcium. So non-dairy milk alternatives have calcium added to them so that they have a similar nutrient profile. How can you estimate your calcium intakes? You can estimate your calcium intakes using something called the rule of 300s. So since many foods do contain some amount of calcium, you can give yourself 300 milligrams from all of the foods you ate for the day. Specific foods are going to be much higher in calcium, such as the dairy foods listed here. And so for each of these servings of a dairy food, you can give yourself another 300 milligrams a day. Tofu, fortified cereals, fortified OJ, or almonds. We don't exactly have a 300 number for those. Many of those are around the hundreds, but you might want to use a diet analysis software to add those to your 300s. And then think about how much you're eating on a day, and is that enough? So it's only about 2 o'clock my time right now, but today I have had probably 3 ounces of cheese. I had a low-fat mozzarella this morning, and that was about 600 milligrams, and then I've eaten other food during the day as well, so close to another 300. So maybe I'm at 900, but I still need a little bit more. Upper limit. It is possible to get too much calcium, and an upper limit is established. With too much calcium, these are the following risks. We saw in that picture of the graph showing the RDA and the average intakes that in general, people are not getting enough calcium. So should we supplement? And the answer to this, like it's stated here, just isn't really clear. There's a lot of controversy that supplementing could lead to adverse responses and adverse side effects, adverse reactions, and that kind of like what we find from most nutrition recommendations, just getting calcium from foods might be better. However, since we see that people aren't getting enough calcium from foods, maybe we should supplement. So these are some studies that I have listed here. One of them, where they took a calcium supplement, worsened their cardiovascular health. And this might be because calcium in excess can form small calcium crystals that actually get deposited in the arteries and veins. And if these build up, that can actually lead to heart attacks. Second study, calcium intakes did not provide any benefit for hip or spine fracture reduction. That's pretty bad news because I thought calcium was supposed to be good for our bones. Well, this study is showing the opposite. There are many other studies, however. So, for example, I have one that was done from the Women's Health Initiative. And in this study from the Women's Health Initiative, they found that vitamin D and calcium supplement, very close to the RDA, helped reduce hip fractures among women who had already gone through menopause and did not increase their risk of other chronic diseases. So I guess you could say the jury's still out. If you were to take a supplement, I would take one below the RDA, because below or at the RDA. So I would not take one above the RDA, because remember, we are getting some from diet as well. What type of supplement should you take? So there's 2 main types out there. There's actually more than 2 types, but these are the most common types. The first one is calcium carbonate, and calcium carbonate contains about 40% calcium. However, that form of calcium requires an acidic environment to be absorbed, and where the absorption takes place is in the small intestine. But we only have an acidic environment for a small amount of time and a small portion of the duodenum, the upper part of the small intestine, because then bicarbonate comes in and pancreatic enzymes come in and they neutralize that acid. Calcium citrate is the second type of calcium supplement, and this has about 21% calcium. It is better absorbed and it does not need an acidic environment. It is, however, a little bit more expensive. So when you're picking up a calcium supplement, if you choose to pick it up, check the label to see what type it is. And I would say another thing too, having one with vitamin D helps improve your calcium absorption. So that's a pretty good idea too. I like this Nature's Made one. Nature's Made vitamins are usually certified by US Pharmacopoeia, which checks them for efficacy, meaning that they work, and goes and audits their facilities for safe manufacturing practices, Also, this one I like because it's at 600 milligrams, so it's not that high, but it does have vitamin D. Next, phosphorus. So phosphorus is actually in so many things in the body. You guys have heard phosphorus before. You might not have realized it yet. It is involved in bone and teeth, and it's the second most abundant mineral in the body. About 85% is found in the bones and teeth. Phosphorus is part of ATP. So remember, ATP is adenosine triphosphate. And where do you think those phosphate groups come from? They come from phosphorus that we eat. Phosphorus is vital for enzymes and B vitamins. Phosphorus is found in cell membranes. Just think about phospholipids. Phosphorus is part of DNA and RNA, which is the genetic material in all of the cells. So phosphorus is everywhere. And it does come from many, many food sources. In fact, most people, most healthy people, do overconsume phosphorus. There are some people who might be at risk for low phosphorus, but generally speaking, healthy population overconsumes. These are some food sources. What you notice about these food sources is they're minimally processed, except for maybe the Raisin Bran here, maybe the yogurt a little bit, but these sources still have a lot of phosphorus. However, where we get the most of our phosphorus is from processed foods, because they add phosphorus to many, many foods, and it serves as a stabilizer, it serves as a coloring agent, and it's in everything. If the food comes in a package, there's a very high chance that it has phosphate in it. For example, dark sodas, pancake mix, brownies, cookies, pastries, pies. It's in everything. Beer, it's even in wine. It's just in so many things, both naturally occurring and added phosphorus. Sometimes preterm infants, vegans, people with alcoholism, or people with very nutrient-poor diets, or long bouts of diarrhea may have low phosphorus intakes. But generally speaking, like I've said, we get plenty of phosphorus. Next nutrient, vitamin D. So by now you should remember what the water-soluble versus fat-soluble vitamins are. We can get vitamin D from food, and we can get vitamin D from this little friend here. Something called 7-dehydrocholesterol in our skin can help us make vitamin D. And 7-dehydrocholesterol is kind of what it sounds like, but it's a type of cholesterol. So remember, we can get cholesterol from food sources as well as synthesize it in our body. And then vitamin D has to be activated by the liver and the kidney. We can't use vitamin D unless it's in this active form. So the liver and the kidney are two crucial organs involved in vitamin D. This is a little bit blurry here, but what this is showing is that there are a couple different types of vitamin D. So there's vitamin D2, which is called ergocalciferol, and this is usually ingested from foods. There's vitamin D3, which is called cholecalciferol, and this is made by our bodies in response to the sun. Both of those forms are converted to 25-hydroxy vitamin D, and this is a type of a D3. It is also possible that there is D2, and if you did a very expensive lab test, you could tell which one was which. So this step is done by the liver, and then the next step right here, it's converted to 1,25-dihydroxy vitamin D. And this is done by the kidney. And so you need a kidney and a liver to make your vitamin D active. I work with patients who have kidney disease, and they cannot activate their vitamin D. that they make from the sun or that they get in foods. And so we have to give them a synthetic activated version of vitamin D. This would be a similar case for people who have liver disease. Why is vitamin D important? They used to think that vitamin D was only important for bones and our bone health and regulating calcium. However, they've actually found vitamin D receptors on almost all organs of the body and many different cells that they weren't expecting to find vitamin D receptors on. And so what that indicated is that vitamin D plays a role in many other factors besides just keeping our bones healthy. And some of them you can see here. So it does help with calcium, but it can also help prevent hypertension, which is high blood pressure, heart disease, diabetes, colon cancer, many more. It might be involved in gene expression, and it might be involved in immune modulation. So it can affect all of the cells on all these different organs. It's really quite a powerful hormone and vitamin. It is both. Vitamin D deficiency. So US experts do believe that vitamin D deficiency does happen in the US. In fact, many adults are deficient in vitamin D. However, they think that about 10% of children might be deficient in vitamin D as well. And this is especially significant because when children are deficient in vitamin D, it affects their ability to maintain that peak bone mass and develop normal bone structure. This child has something called rickets. And what happens in rickets is the bones don't calcify. They don't have as much calcium and other minerals in them that they need. And that causes them to be kind of more flexible versus solid. And so when the child stands up and weights those bones, they actually bend out because they can't support the weight of the child. And then they continue to grow this way. This can also affect the spine. It can lead to higher incidence of fractures later on in life and be quite debilitating. Something that happens in adults is called osteomalacia. And this is similar to rickets, but in adults, and it means soft bones. And it can be due to decreased calcium intakes, inability to use or absorb calcium, which could be impacted by vitamin D status. So generally speaking, vitamin D can be supplemented. Aging is especially kind of problematic for the bones because with aging, people can't make as much vitamin D when they go out in the sun. And in fact, the skin's ability to make vitamin D is reduced about 70%. Oops. There we go. Okay. So where can you get your vitamin D and how can you meet your goals? The RDA for vitamin D is 600. And it's very possible, I would say likely, that larger doses are okay. That being said, I would recommend that everyone get their vitamin D checked. This would be covered by your insurance. All you would have to do is ask your primary doctor or even a female doctor or any sort of doctor to order it for you. Because that way you can know what your vitamin D levels are and if you are low or deficient or not. And this can help you determine what type, and not really what type, but how big of a supplement you might want. It is possible that a doctor could give you a prescription strength vitamin D supplement if you were significantly low. So yeah, I encourage everyone to get theirs checked. You might be surprised. I do take vitamin D supplements and I have for a while. I do go out in the sun a lot. I do eat some of the other sources of vitamin D. I do, however, wear sunscreen. I wear hats and I wear sunglasses. And I had my vitamin D checked and it was 31. And 30 or less is considered deficient. So I was pretty surprised that mine wasn't higher. So we're going to talk about some food sources coming up. The upper level for vitamin D is 4,000 IU. So like I said, it's probably okay if you took more than 600 because you're still going to be pretty far away from that 4,000. If you were to exceed 4,000 chronically, meaning for a long period of time, it is possible that you could overabsorb calcium, and then calcium could form these calcium deposits, kind of like what I talked about with cardiovascular disease. There are additional symptoms of toxicity, and supposedly it can be even able to cause death. I have not heard of any cases of that, but I guess it would be possible. And then a good question is, can the sun cause toxicity? And so this is a really cool thing, but vitamin D toxicity does not result from us going out in the sun too much because our body regulates how much our skin will make. And so if we already have adequate levels, our body won't make as much as it previously did. Factors that affect vitamin D status. So we've talked a lot about the sun. If you don't go out in the sun, or you're covered up with hats and glasses and long sleeves and sunscreen like I am, you might not be making your vitamin D. This is pretty common for elderly people. 1, they don't go out in the sun. 2, they cover up. 3, when they do go out in the sun, their skin does not make as much of it. Dark skin pigmentation can also reduce ability to synthesize vitamin D, inadequate dietary intakes, exclusive breastfeeding. It's actually recommended that infants are supplemented with vitamin D, fat malabsorption or cystic fibrosis, because remember, vitamin D is a fat-soluble vitamin, liver disease, because you would not be able to activate vitamin D, certain weight loss medications, specifically if they cause fat malabsorption. Obesity is an interesting one. In obesity, what happens is you can actually store the vitamin D. So you're storing it because you have so many fat cells, and it's not released into your body because instead of breaking down those fat cells, you just make more fat cells. And then kidney disease, because the kidney cannot activate it. So our friend the sun here. So when we're out in the sun, UVB rays help us create vitamin D. And this is actually where the majority of our vitamin D comes from. All we have to do to make just as much as we need is be out in the sun for 10 minutes. And supposedly this is all we need to do, is just have like arms and legs exposed, and that's enough. However, the sun is not always out. What happens in winter? What happens at nighttime? What happens in Alaska, where certain parts of the year they have only 5 hours of daylight? Well, it is very possible to not make enough from the sun and be places where there is seasonal vitamin D deficiency, or where supplementing vitamin D will be very important because you're just not out in the sun that much. These are some food sources of vitamin D. You can see fatty fish. It's up top in the purple. You do see the dairy products, and then you also see some fortified cereals, margarine, etc. So it is fortified in orange juice and vitamin D. I've mentioned already, but it's also fortified in many protein bars, breakfast cereal bars, etc. And it's kind of important, and it's kind of desirable. So I think manufacturers are adding this to products to try to kind of bring the customers in. If you have milk and cereal together, which most people do, you will get about twice the amount of vitamin D than if you just had cereal or you just had milk. Supplement forms. So you can take either D2 or D3 in a supplement form. D3 is considered kind of the most biologically active form of vitamin D because that's what our body would be making anyways. D3 is available over the counter, usually in amounts even up to 5,000 IU, which is over the UL. And then D2 is also available over the counter. However, D2 is commonly given as a prescription. And when they give this as a prescription, it's usually when somebody is very low in vitamin D, and they give them like 50,000 units of D2. So like I said, all infants need this, and any adolescent that's not getting enough from their diet should probably also take a supplement, as well as a vegan who potentially isn't getting enough from their diet. Vegan diets can absolutely be adequate in calcium and vitamin D. However, it's just important to know that they are so that you don't become deficient. Magnesium. So you're noticing a trend here. Magnesium, like all the other things we've talked about, is found mostly in bone. About 60% of our magnesium is found in bone. However, it, like the other things, has additional functions as well. It's important for nerves and heart function, muscle contraction, tooth integrity, and DNA synthesis. Adequate amounts of magnesium may reduce cardiovascular disease by decreasing blood pressure and dilating arteries. Deficiency of magnesium can lead to irregular heartbeat, weakness, pain, seizures, and disorientation. Diets rich in magnesium-containing foods, I'll add this, are also associated with lower risk of type 2 diabetes. So that's pretty important, especially because type 2 diabetes is such an epidemic. So getting enough magnesium. Again, there are food and supplement sources. Some things can reduce your ability to get enough magnesium. For example, alcohol can reduce just healthy food intakes as well as increase excretion. Excess sweating or diarrhea can cause deficiency, and toxicity is possible, usually due to supplements or low kidney function where you might not be able to excrete it. It's funny that diarrhea causes deficiency, but toxicity can also cause diarrhea. And that makes sense because if your body knows it has too much, it's going to want you to get rid of it. These are some food sources of magnesium, and here you actually see all of the colors of the food groups. So magnesium is plentiful in many different foods. It does come from the plant pigment chlorophyll as well as some animal food sources. Fluoride. So fluoride is very important to the bones, and it is also found in the teeth. And usually city water, the water that comes out of the tap, has fluoride added to it. Cities can decide to do this to their water, and the majority of cities in the United States do. The reason that they do is because a certain level of fluoride intakes is associated with a significantly lower level of cavities. I'm going to talk about some other things that are really exciting. Okay, so functions, strong teeth. Here you see it's also in mouthwashes, it's in toothpaste, it's in your water, and it's important to our teeth because it helps them become resistant, and specifically it helps them become resistant to bacteria that produce acid and bacteria that hide inside the plaque and break down our teeth. It can also help with production of new bone. Getting enough fluoride. These are some natural sources of fluoride as well as the water. It is in tap water, however, it's generally not added to bottled water. And if you've ever heard of reverse osmosis, this is a water kind of filtration and cleaning method, and that does remove fluoride. So while it might make other components of the water more desirable, it won't make the fluoride more desirable. So you should know some sources of fluoride. Too much fluoride. So if you have too much fluoride, it can cause something called fluorosis. And fluorosis is this mottling or speckling of the teeth. And sometimes it's like a white color. However, here you see it is a brown color. And this is really interesting because when fluoride was discovered to be associated with cavities, preventing cavities in teeth, it actually was discovered in Colorado. And so there was this one town in Colorado where everyone had brown teeth. They had brown speckled teeth. And so they called it Colorado brown spot. What a great name, right? And so these people had these brown teeth. And what they found was that these people actually had lower rates of cavities than any other people. And so they wondered, like, what is it with these brown teeth? And they tested the waters, and they tested this, and they tested that, and they didn't find anything. But to be honest, they weren't really looking for the right thing. They weren't really looking for the right thing, number one, and two, they didn't have very good testing methods. So later, a few years later, another city with people with brown teeth was spotted, and I can't remember where this was, but it was somewhere in the Midwest. And this city had a big water treatment plant. And so they thought, well, there's something bad in the water that's causing these brown teeth. The water treatment plant had a lot of money and very sophisticated testing mechanisms. So they started testing the city water, and they identified it as fluoride. And so people in both of these communities did have brown teeth, but they had no cavities. And back then, people were getting cavities very frequently and losing teeth very early. So the idea that something in the water could prevent cavities was very astounding. However, nobody really wanted to have brown teeth. So years and years went by, and they actually optimized the level of fluoride that people could intake to reduce cavities as well as not cause this brown teeth. However, if you intake too much fluoride, you can still end up with this brown teeth, and it's called fluorosis. From what I have heard from medical sources, fluorosis of the teeth is not dangerous. However, I believe our book says otherwise. That does not mean that having too much fluoride in general is not dangerous. Fluoride is actually a toxin in high amounts. So the risk is if people are swallowing toothpaste, not spitting out toothpaste, eating toothpaste, or eating other high sources of fluoride, this could happen. And so for infants and children, usually for infants, they recommend non-fluoride toothpaste. And then for children, they recommend a very, very small rice-sized drop of toothpaste, and you supervise them brushing their teeth so that you can encourage them to spit it out and not swallow it. There is a lot of controversy on fluoride. I'll add this too. And there are groups of people who believe fluoride is put in our water to poison us, as well as fluoride treatments given at the dentist are very harmful. And so if you're interested in that train of thought, you're more than welcome to look it up on your own. However, generally speaking, science has refuted it, and science has shown fluoride in an appropriate dose to be safe and helpful. Other nutrients. So we talked about quite a few already. However, there are additional ones that help with bones and teeth. Vitamin C, a big antioxidant, also involved in collagen synthesis. Vitamin K does help with bones. It helps modify the bone protein osteocalcin. Potassium and magnesium help maintain an alkaline environment in the blood so that bone doesn't have to be broken down and help with that alkaline environment. And then boron helps influence osteoclast and osteoblast activity, and silicone participates in collagen synthesis. Osteoporosis. So osteoporosis is a type of bone disease, and there's different classifications of osteoporosis, but osteoporosis is weakening and hollowing of the bone, meaning there's less mineral content of the bone, there's more air, bigger spaces between the bone minerals, and people are more at risk for fractures, bone pain, instability, etc. And so this is a very, very expensive disease. This is also a very, very prevalent disease. And from this graph here, you can see that it is primarily in whites or Caucasians. Asians are not shown on this graph. However, I would expect Asians to be kind of similar to whites because they also are at risk for the low peak bone mass. One of the major fractures that osteoporosis often leads to are hip fractures. And this happens usually with old age. The average age for a hip fracture is 82. And hip fractures are life-changing and not in a good way. These are severely debilitating fractures. I have some statistics. I won't ask you these numbers, but I think they're interesting and horrifying. So within a year, 90% of people who had a hip fracture need assistance with stairs. 66% need help getting off the toilet. 50% can't get up if they're in a chair. 30% can't get out of bed. And 20% can't even get dressed. So very, very, very debilitating, very, very costly, but also potentially preventable if you think about some of the modifiable risk factors we've already mentioned, such as building optimal bone mass. So we can build optimal bone mass by reducing our exposure to harmful things such as alcohol and smoke and sedentary lifestyle, by exercising, by having good diet. And if we build optimal bone mass, then by the time we're in our 80s, we're just in this upper green section, which means we do have low bone mineral density, but it's not that low. If we never have a good bone mass to begin with, then by the time we're in our 80s, we're in the severe stages of osteoporosis. And this can cause disabilities, fractures, loss of skeletal height, etc. So this is a woman that looks kind of like my grandma. And, you might have seen this, that the vertebrae kind of collapse upon each other and people actually lose height and they become more disabled. So one of the first questions in the beginning of the lecture was, can you get calcium from sources other than dairy? And the answer is absolutely. There are many non-dairy sources of calcium, and I have them listed here. Vitamin D. What do you think a good source of vitamin D is? Remember, mushrooms, orange juice, fortified cereals. Those would be all non-dairy products. Potassium, rich in fruits and veggies. B12 in fortified foods and nutritional yeast. And then milk alternatives, like I've already mentioned, do generally have calcium added, and some of them have vitamin D added as well. These are some examples of dairy alternatives. And when you get one, read the label, just make sure it has calcium and vitamin D. In conclusion, so we talked about a lot of factors that can influence bone health today. And hopefully that will allow you to make some good dietary and lifestyle choices to modify those factors that you can and improve your peak bone mass. Because once we kind of round that corner around age 30, we can't really go back and build the peak bone mass. So do your best to stay healthy. The answers to the questions on the trivia, they were true. Can't remember the questions in order, but there were 206 bones, and you absolutely can get calcium from non-dairy sources. So thanks for listening. I hope you enjoyed today's lecture, and I'll see you next time.